My name is Ed. My conditions are generalized anxiety disorder and mixed anxiety and depression disorder. The way these affect me is just I'm very unable to, function as a normal human being. I can't go outside. I can't, go into my garden without feeling nervous or at least considering excessively the way that other people feel. So before medical cannabis, I had been prescribed mainly sertraline since about 2016, and that has been my biggest hurdle. Really, it's essentially I didn't know what I was getting on when I started it. I was not explained whatsoever what an SSRI is. I didn't even know until 2 weeks after I'd started taking sertraline that it was something that is slow release and it's over an extended period of time. So I just had to suffer with the withdrawals from that. I just really don't like the withdrawals from that, and it's what caused my first and only suicide attempt in university. That's what caused me to leave at the end of my first year, was an attempt at my own life, and that was because I was skipping sertraline and I didn't have anyone around me at that point in time. So yeah, literally the result of me skipping, so even I think I only skipped like 2 or 3 doses of sertraline, and I was in hospital, and that's been really my I think that was my calling, really, that medication wasn't so much for me, or at least what the doctors were prescribing me maybe wasn't helping me. So I found out about Project 2021 via a social media platform called Reddit. I found out about it from a semi-private Reddit called r/UK Medical Cannabis. It's a lovely little place that you can go and easily access any information that you want and easily ask questions to other patients. So for me, medical cannabis has changed my life by really giving me the start of a direction, and for me personally, hope. I spent the best part of the last 3 years chasing around the NHS and psychiatrists trying to get them to give me more medication, because I thought I was under the impression that that would help me, but the reality was that I had to help myself. And yeah, cannabis really enabled that, and there wouldn't be any cannabis for me, at least medically, without Project 2021. That's not an understatement, because I legitimately could not afford right now to be a patient and consume the amount of cannabis that I need to without Project 2021. The other aspect that it helps is my family. So my mum, especially, I live with my twin and my mum, and my mum does not appreciate cannabis at all. If anything, she dislikes it. She had quite a bad introduction to cannabis from my older brother, because he had a lot of experiences with street cannabis and street drugs and the police. So that really rubbed her the wrong way. So she, even now, if I mention to her about medical cannabis, she finds it hard to talk about. And that's because of the fact that she's been told her entire life that it's this bad thing, but she's seen in person how much it's helped me. I think she knows better than anyone else that it helps me, just become a better person. I wouldn't be able to sit here and say this right now if it wasn't for Project 2021. As simple as that. What needs to change with access to medical cannabis is there needs to be clarification across all legal bodies within the UK. At the moment, you can go across to any medical cannabis clinic and they're happy to tell you that it's completely legal and you can get prescribed today. Yeah, like it's pretty affordable as well. But you go on Facebook or another popular social media platform, you go on your local police, they are still burning cannabis farms and prosecuting people for growing that cannabis. And that's all under the ruse that, oh, this drug's illegal, this trade's bad. And yes, but it's bad because it's illegal. If it wasn't illegal, then it wouldn't be such a bad thing. Half of the problems with medical cannabis come from it being illegal.